Hi, everyone. I'm Catherine Ayers-Wickenhauser, Director of Communications at Direct Trust, and I'm so excited to be joined today by recently named Interop Hero Cait DesRoches from OpenNotes. Cait, welcome. Will you introduce yourself and tell us more about OpenNotes?
Hi, so I'm Cait DesRoches. I'm the director of OpenNotes, which is a research-based initiative at the Beth Israel Deaconess Medical Center in Boston. We evaluate what happens when patients have easy access to the information in their electronic health record. So we do both sort of best practices for how to share information with patients and evaluate then what happens for patients and clinicians when they have this kind of easy access.
Amazing.
I want to just be really clear. I want to say what OpenNotes is not. So we are not a vendor of any kind. We don't have an app. We don't know how to make apps. So we don't have an app. We don't have a server somewhere, that's full of notes. We're not an electronic health record vendor. We are a group of clinicians, researchers, patients, experts in dissemination who work together to improve healthcare through increased transparency. And we're funded completely through grants, so federal and private foundation grants and some philanthropy. We have no commercial conflicts of interest.
Thank you. And thank you for that clarification too, because I know at Direct Trust, we often face the same issue in those questions, just trying to understand where different groups fit into this ecosystem that we have in health IT and trying to advance some of our own areas of thought leadership and things that we're advocating for. And I know that something that OpenNotes has been advocating for recently became law of the land. So could you tell me a little bit more about what happened recently and what you all are focused on now that that's kind of happened?
Sure. So I'll go back a little bit in time to 2010, when there was a small pilot project at the Beth Israel Deaconess Medical Center, Harborview Hospital, which is a safety net hospital in Seattle, and Geisinger, which is a healthcare system primarily in rural Pennsylvania. And at that time, 100 primary care physicians were volunteered themselves to share their clinical notes with their patients. So the notes that clinicians write about a visit after the visit, they agreed to make those notes available to patients through the patient portal. Now, at the time, this was a really fringe idea. There was a lot of skepticism that this would work at all, that they would even get that any clinicians would sign up to do this. So it was a very fringe idea, but they got it done. And 2 years later, the results came out and they showed that patients uniformly loved having this kind of access. Most of them read at least one note, and they reported benefits like, I feel more in control. I'm doing a better job taking my medications. I recall my care plan. I shared this note with someone else, like a care partner. And they all wanted access to the notes to continue even after the pilot was completed. For clinicians, despite many, many worries early on, pre-implementation, they were very worried about changes to their workflow, about being inundated with phone calls and emails from patients. The biggest thing that we heard was, are you sure that this is turned on? Because I am not hearing from my patients the way I thought I would. And none of them decided to turn access to notes off after the pilot was over. So on this kind of strength of that, the OpenNotes initiative, we received a significant grant from 4 foundations to work on trying to spread this beyond these 3 sites and primary care. So over the years between like 2014 through now, we've worked extensively on best practices around dissemination, education for both patients and clinicians. And then recently in 2021, OpenNotes became the law of the land. So as part of the implementation of the 21st Century Cures Act, notes are included in the information that has to be exchanged easily between providers, but also made available electronically to patients. So a big change from that fringe idea in 2010 to a federal regulation 12 years later. And in the life of healthcare, that is like lightning speed for that kind of change to happen.
That's what I was just going to say.
Yeah.
10, 11, 12 years sounds like a long time, but in healthcare, it's really fast to see that type of change. And it's really incredible, I think, to me, to hear that testimonial in and of itself, that the providers who participated in the pilot, no one wanted to turn it off.
Right.
Just incredible. And I know over time, OpenNotes has done a lot of education. And like you mentioned, you've been putting out best practices. And I think probably hearing some feedback and honing what those best practices might be and some of the resources that are out there. But I'm curious, maybe if you could describe a little bit more about how you've encouraged organizations to embrace the spirit of the rule, and how maybe also how have you asked patients to advocate or seen how they might participate in advocating for their own care too?
Sure. So I'll start off just by saying that I've worked around healthcare IT for some years now, and I worry that that organizations will comply with the letter of the law around information blocking, but not really with the spirit of the Cures Act, which was that this information, patients should have access to this information so they can use it to make decisions about their care. So what I try to sort of stress is there are real benefits for patients and few drawbacks for clinicians to share information like this. So, but we won't ever get to that benefit stage if patients don't know that the information is available, that they don't know why, and they don't know why they might want to look at it and how to get to it. So I encourage organizations to shift their thinking away from this is just something we have to comply with, to this is something we can really do that will improve care for our patients. And at a sort of relatively low cost for us. We're already sending this information to the portal. So the next step is just how do we get patients to use it? And if we get to that point where the transparency is really woven right into the fabric of the care an organization provides, then patients will be able to understand why they might want to look at their information. And not everyone will, and not everyone has to. But for many patients, it's a powerful experience. And it's very helpful for them to remember what the doctor says, to remember why they're being prescribed a certain medication or what kind of follow-up care to get. And those things are a real, they're a real problem for clinicians, right? We know that these are known problems, these things that happen after a visit. Patient comes in, they get bad news, they hear nothing else that you say for the entire visit. So the note provides them with a record of what happens. And encouraging them to read it in between visits can help them be better prepared. So I encourage organizational leaders to focus on those kinds of benefits rather than the low likelihood of real problems.
And, Cait, as you're describing this and this process and what's happened now, especially since we've seen 21st Century Cures been implemented, I also see this parallel path with other parts of interoperability, being required, but not fully understanding the benefits, and maybe participating to the required level, but not going the additional lengths to embrace the spirit and intent of what's out there occasionally. And so, I've seen from looking at the OpenNotes website and just from other educational resources that are out there, what a tremendous job OpenNotes has done at educating and providing resources. And so I'm curious, maybe could you describe a little bit more about the educational pathways that you all have pursued and your philosophy there? And then if there are any lessons that you think maybe the other parts of the interoperability community could learn from?
So I'll go back and I'll talk a little bit about what we did prior to the 21st Century Cures Act. So the information blocking rule. So before that, we did a lot of talking to clinical champions, organizational leaders, and our strategy was always, if we were going to, a healthcare center in wherever, Kansas, to have patients with us, because having a patient in the room who can talk about why having that information available to them is key, or why they need access to their parent's record or to their child's record. That helps to shift the conversation away from should we do this to how can we do this in a way that really helps. So having patients in the room is key. And also understanding that this is an educational process for everyone. So clinicians are trained to think that the notes, first they were trained to think the notes are for them. Then, then of course there's an added layer of now the notes are used for billing and things like that. But they're not trained to think of patients as an end user of this information. So doing some of that work, a culture change work, that's really, it's hard but necessary. Patients also need to understand what's available to them. So having materials that are appropriate for different literacy levels and different comfort with English, different sort of comfort with digital technologies, all of those things are necessary for patients as well. So I would say my big advice is don't assume that your audience understands what you're talking about, because they're busy, these are busy, patients are busy living their lives, clinicians are busy providing care, and they may not have ever thought of your issue before. So you really need to make sure I think that can be one of the shortcomings of how we try to get change to happen, is not adequately explaining and bringing people on board with the idea that this actually has a benefit to real humans, and it's not another sort of just whiz bang thing that we're talking about.
Right. And, sometimes I think within the health IT industry, we're a little insulated, right? We
Yes.
talk our own language, we have our
Right.
own words, like interoperability. Well, clinicians aren't using that word for the most
Right.
part, so we need to change the language and how we present things, and really honing in on the benefits for all of the people involved. But again, I see so many parallels here, I think, between what you all are doing at OpenNotes and also these other pieces of the interoperability community, and what they can learn from the example that you provided. Because like you mentioned, within a span of 10 to 12 years, you got a lot done. I mean, you really shifted the expectations for patients, and something that started out as that pilot then became the norm. And how incredible is that? So we certainly should carry that spirit through to other areas of the interoperability community. If we've had other guests here and have certainly heard other people within the industry describe, a lot of the infrastructure is there, right? That from the OpenNotes side too, a lot of the infrastructure is there. It's just now kind of following through and looking at other places where we can make it accessible and do the things that we need to do. And I love that you all have examples on your website of example communications pieces, so that clinicians and healthcare organizations can understand how they might present the OpenNotes opportunity to their patients, to their consumers, the people who walk through their doors. And so certainly I think that's a lesson learned, that our aspect of the interop industry and health information exchange needs to take away from OpenNotes, because
yes, I think that, you know, one of the things that we tried to do was we tried to lower as many barriers to adoption as we could. And we don't have control over, for example, the culture of an organization. So there's a limit to what we can do there. But one of the things that we did do is have all the materials ready. So if we had an expression of interest right away, we could give you, here's text for an email you can send out to your patients. Here's a white label poster that your communications people could brand with your own information, and you can put it up. Here's, you know, various kinds of white, they're really like white label communications materials, so that the organization, they don't have to spend their time thinking about it. You know, we have spent so much time thinking about it that we just have this stuff ready for you to go. And I think that the HIT community could do a lot better job in committing resources to that kind of work, because it takes time, effort, you know, energy, and it does require resources. But I think in the end, it will serve the community well to have information that patients or clinicians can look at, and, you know, they understand what it means. It's not jargony. It speaks to the importance of it for them, and that can go a long way in helping to kind of smooth your path.
Totally. I could not agree more. And I think looking at barriers to seeing more interoperable exchange and seeing kind of the future of where we might go from here, you know, thinking back to kind of that infrastructure and what's been built, looking at the health information exchange, clinician to clinician and other side of things, I think often clinicians don't know what they have. They don't know that they have this capability. And so that's where I think looking to you all as an exemplar is great for our portion of the interop and health IT industry, just to see, okay, education and these conversations, this communication is so critically important, and it matters because this is what moves the needle. And so I'm really excited about that, because I think other pieces of our industry are also starting to support that. And to me, it is a message that we can all unite behind. It doesn't matter what organization or what efforts or what standards you're part of, we all can get behind this idea of information exchange, because it's the best thing for the patient. It helps providers provide the best care. And so looking at what you all have done at OpenNotes, it's incredible to see the pieces too that tie to the quadruple aim, from my perspective of having those patients involved in their care. And I think also lessening provider burden, because the patients are engaged in their care. So I'm really excited about that. And thank you for sharing that information. I am curious too, is there anything else that you're doing with education, or any lessons learned that you would want to share with us too?
So we do have a new project that is focused directly on educating clinicians around writing notes in a time when they're available to patients. And we're just getting started with the project. We're going to pilot it with Harvard Med School students in the practice of medicine class, and then there'll be some curricular content for them, and then some curricular content for their preceptors. And it will focus on, you know, how do you write your note in a way that that isn't just, okay, I've complied with the spirit, the letter of the law, but, you know, what are small things you can do that signal partnering with patients, that signal that you see that patient and you understand, you know, whatever it is that they're struggling with. How do you write culturally competent notes? How do you write a note that satisfies billing requirements, but also can signal this kind of, I heard you, let's partner together. So we are working on that. And again, I mean, it is really an education process for clinicians. Now, my theory is that younger clinicians, as they come up through, medical school and residency, they're used to doing everything online. And there's this larger cultural argument going on right now about who owns my data, who can have access to it, and what can they do with it. And I think some of that is influencing what we're seeing around health IT and giving patients greater access. But getting kind of in on the ground floor with these med students, before they get into residency, before they get in, because residency has such a huge cultural effect on them, is just, we're excited to see how that works.
Certainly. And I think this is absolutely brilliant. And as someone who has a physician spouse and knowing how influential residency and medical school was, and then even just seeing, our network of friends from that time period too, and where they are and the influence that they have, this is, I think, a game changer. It's really cool to think about the multi-pronged approach to not just the legislative and the regulatory approach of this is required, but also starting with why it's important and getting in those habits from the beginning. It's totally incredible. And I think there's a lesson that we can certainly learn from that and hopefully emulate as well. So, maybe that shouldn't necessarily be innovative. I think for health IT, it is possibly innovative, but what other things are you doing? How else are you innovating now?
We've been getting a question, not so particularly around the time that the information blocking rule went into effect, of what are you guys going to do next? This is now the law. Are you all done? And of course, we don't think we're done, because this is. We want to get to that place where transparency is just a regular part of the care that organizations provide. So we're working on things that sort of fall into I would divide them into two categories. One is, how do we implement this in a way that gets people on board and using it? So those things are sort of, those in particular are focused on, we have a couple of projects focused on proxy access to the portal for care partners who need access and need their own login credentials. How do we tell them about the portal? How do we get them signed up, and how do we get them using it? So that's one area. And the other is, greater transparency can have significant effects on the safety and quality of care provided. Patients can find mistakes in their notes. Patients can use their notes as a way to remind themselves of what they're supposed to do in between visits, in those kind of blind spots that clinicians don't see, and they can't see because it doesn't happen in their office. So we have a couple of projects that ask patients to log in after a visit, read the note, and then fill out, come back to us with, were there any errors, major error, significant errors in the note? Report on things like, my note said I was supposed to get this follow-up appointment, but I haven't been able to get it scheduled, or I think I've been taking my medications incorrectly based on the note. And that information is then fed back to the clinician in a feedback loop before the next visit. So it gives the clinician a sort of window into what's happening in between the visits and can help catch safety breakdowns before they become real problems. So we're focused both on this, how do we implement in a way that really gets people to use it, but also what are we going to do? How are we going to really capitalize on transparency? How can we use it to get at some of the really intractable problems that we have in healthcare? And
it's so great to hear that constant loop, that innovation, and that now that OpenNotes is part of what's out there and required, that still there is a place and that the industry can expect to see more from you all, and that evolution and enhancement. And that's so critical. I think that continuous improvement, right?
Yeah. So I think because we're outside, we're sort of adjacent to the IT community, it gives us sort of freedom to think about what's possible without being sort of constrained by a particular platform or a particular type of technology. And I do think that that's helpful for sort of driving change forward in the IT world.
Totally. I totally agree with you. We've covered a lot of ground in our conversation today, and I really appreciate you being here and telling us more about OpenNotes. And certainly I know I've learned a lot from our conversation and seeing you all as an Interop hero. And so just as we wrap up today's conversation, thank you for being here and telling us more about OpenNotes. And do you have any final thoughts or words of wisdom you'd like to share?
Final thought, and I say this almost every time someone asks me for a final thought, is that this kind of transparency, it's not meaningful unless someone's looking. So we really want to get to the place where patients are finding the information and using it for their care. Otherwise, we've just created a lot of angst for clinicians and a lot of angst for EHR vendors as they try to figure out how to comply with the rule without ever getting to that benefit stage. So I encourage people who are watching this, people in your community, to think about, as you're doing your work, how can you help to get us further down that continuum to where we're really it just is part of your everyday care to think about, oh, I ought to look and see what my note said, or I should check these labs, or I should write back, and let people know that I couldn't make this appointment, or whatever it is. So just think about how you can add that component to the work that you're doing.
Great parting thoughts. And thank you again for being here today, Cait.
No, you're welcome. Thank you for the opportunity. I mean, this is great.
We learned so much from today's conversation, and to watch other conversations like this, check out the Interop Hero section on the Direct Trust website at directtrust.org/Interop Hero.